Hi, I'm Mort Cooper, your host on Change Your Voice, Change Your Life. In studio with me is Dr. John Curtis, my co-host, and we're talking about voice insanity. What does that mean to you or to anybody else? Dr. Curtis, you came up with the title. What's the definition?
Well, you know, the whole voice field is just seems insane right now because your view of the field is diametrically opposed to the entire medical establishment. And I think what is so fascinating about it is that you are the only one presenting cures of this dreadful condition, spasmodic dysphonia, in the entire world, not just in Los Angeles, not the United States, but on the entire planet. You are the only one that is offering cures, and yet the medical establishment says that cures don't exist.
Does that intrigue you?
I think it's fascinating, especially given that you know, the medicine is supposed to provide patients with up-to-the-minute treatment and the best cures, the most expedient treatments. What could be more expedient than an injection or a surgery or something like that? I understand that you get results with people in sometimes seconds, minutes.
Well, I don't get results. What I can do very quickly is find their real voice. The medical community says that the condition, the strangled voice, spasmodic dysphonia, is a strangled, strained voice. You hear it on people like Robert Kennedy Jr., Diane Rehm of NPR. This is strangled. Talk like. It's a strain in the lower throat, and the medics are saying it's a dystonia, which means it's a neurological problem, and you can't change it. So what I'm doing is showing the patients and the people in my field, having presented over the years, the American Speech and Hearing Association, 1974, 1979, in the year 2000, for 3 hours, showing them how I find cures of spasmodic dysphonia by changing from the lower throat to the face. Because all strangled voices in the lower throat, the medical community and I agree on that. But they're saying it's a dystonia, which means neurological, and I can't do it. I do it repetitively, and it's relatively simple to do. But then it takes time to secure a carryover to a cure.
What's interesting about it, the notion of insanity, you know, we're talking about voice insanity, is to some extent a consensus. That is, you have to have like an agreement of a large body of opinion. Like the large body of medical opinion and pharmaceutical opinion today believes that this condition that you're talking about, where the voice is strangled, even these strained voices, are really due to reflux. Now, what's your take on that? You've been watching these patients. You've been seeing them go to their ENT doctors. Do they have reflux, many of these patients?
Yesterday I saw a young man. He had a terrible voice. And he's been on reflux drugs for some time, and a period of years. He's been switched from one reflux drug to another because the ear, nose, and throat doctor believes one may not be sufficient, another may be the answer. He was so bad that he finally came in because he needed help, and he wasn't getting it from the medical help or the speech pathologist.
So he didn't find that the reflux drugs improved his voice, because isn't the medical theory that regurgitation of gastric contents that include pepsin and hydrochloric acid somehow leak into the vocal cords, creating this raspiness or strain in the voice? What's interesting about that is that after taking the reflux drugs, which is designed to neutralize any of that acid, you're suggesting that there isn't a corresponding improvement in the voice condition that the patient presented with.
Yeah, that's my clinical experience, and it's over and over and over and over, patient after patient. He is an ongoing statistic that I see, where he has tried reflux medication, doesn't work. He has tried speech pathologists who are not specifically trained in voice, and the speech pathologist told him that reflux medication is the way to go. The ear, nose, and throat doctor has told him, but he's not getting anywhere, and he can barely talk. So I changed his voice to a clear voice for him within a morning session of about 4 hours.
Is there a difference in your opinion, and this is for the audience to know, between a fact and a theory? What is the current theory today, the medical theory of voice dysfunction related to spasmodic dysphonia?
It's related to reflux acid as a basic cause. Other theories are that it's a basal ganglia problem in the brain, chemical imbalance in the brain. psychiatric care. It's also molecular biological cause. It's this other one we mentioned, reflux, is also called GERD, gastroesophageal reflux disease. They made it a disease. And then there are other theories that come along, but none of the medical theories have ever resulted in a single cure since Strauss first described the condition in 1871.
Now, that's a long time ago. Now, if this condition were really due to insanity, and I understand when you were trained back, you know, in the days at UCLA Medical Center and other places, that the patients with spasmodic dysphonia were looked at with sort of a jaundiced eye. Is that true?
Oh, absolutely. They were strange creatures to my colleagues in medicine and to me.
So they did think that they were psychiatrically imbalanced people.
Yes, we were taught to believe in that misconception.
But was that the paradigm, the medical paradigm at the time?
Yeah.
Is that spasmodic dysphonia, this strangled voice, was due to a psychiatric problem?
Yeah, there was a mind problem, and these patients were like Hannibal Lecter, liable to reach out and
or bite you or attack you or something.
Attack us and so forth.
Well, when did it finally occur to you that these were normal people with strangled voices?
I mentioned it before. In 1968, a woman had strangled voice, severe spasticity, visited the head and neck division, which I was on the faculty as a clinical assistant professor, and she was sent to me. Spasmodic dysphonia was considered hopeless, and be careful of the patient who had the condition.
And incurable.
Incurable.
But doesn't the medical profession, even today, and we're talking about almost 40 years later, 35 years later, don't they regard this condition as incurable today?
Absolutely. Totally.
And doesn't that fly in the face of what I call the facts?
Yeah.
And there are facts, not just a theory, but there are actually facts. What are the facts?
Well, this young lady with the severe SD back in '68 misunderstood me and raised the pitch of her voice rather than lowered the pitch of her voice, which was the modus operandi. She came back the next week, and she had a perfectly normal voice. I didn't know who she was. We saw so many patients each day. And I checked her record to realize that she had spasmodic dysphonia, and she's talking with a normal voice. It's impossible. And there it was. She had a perfectly normal voice. And I was amazed. I realized that spasmodic dysphonia, the strangled voice, can change. Now, then it was believed to be a psychiatric condition. Today it's believed to be a neurological condition. And they're saying the same thing, that the strangled voice cannot change. You can't get a normal, clear voice. So it does change by placing the voice up in the face, away from the lower throat. I realized that back in '68, and when I left UCLA Medical Center and went into private practice, I carried over that concept. It was an epiphany. Epiphany means basically that it was a eureka moment, a shock.
It's like a revelation to you.
A revelation.
And it was completely unexpected, because you had actually given the patient the wrong directions.
Absolutely.
She came back, did not follow your wrong directions, and told you what she did. And the raising
in my
of the pitch
mind, she thought she
was supposed to lower the pitch,
yes, right? Amazing moment of truth, and because I was trained in voice.
But it shows you, to some extent, that even you, back then, were clueless with respect to how to treat these conditions.
Oh, absolutely.
So you fully admit that at one time of your career.
There was nobody who had a single cure. In fact, a fellow by the name of Deso Weiss wrote a book in 1971. He was a psychiatrist in New York City and a famed voice doctor as well, an expert. And he wrote in his book called Functional Dysphonia. That means misused voices, folks. We use big jargon in our field.
But it also means non-organic.
Non-organic.
Non-organic voice, right? Functional.
Yeah, it means non-neurological.
It's not neurological. It's not a biologic problem.
You're doing something wrong to yourself. Okay. He wrote in his book that anyone making any inroads on this condition, spasmodic dysphonia, any inroads would be making an Olympic achievement. Any inroads. I thought that was a very interesting challenge. I'm turned on by challenge, and I like to question what's going on, what is a fact. The fact is that until 1970, 71. Nobody was reporting a cure of the condition, and that 68 incident opened my mind, my eyes, and my awareness that the field of medicine and my field, speech pathology, was on the wrong road. And I changed my idea of the SD patients, spasmodic dysphonic patients, to realize that it wasn't a mind problem, it was a problem of voice placement. A simple voice placement change from the lower throat, where all spasmodic dysphonia today is agreed to be in the lower throat, to the face, where all good and great voices are.
In fact, didn't you work on a study back in the early 1960s that became your doctoral dissertation, that indicated that if you can take the voice and change the placement of the voice, then you can actually reverse organic growths on the vocal cords.
Pre-malignancy. It wasn't just nodes or polyps. Nodes and polyps and contact ulcer were known to be amenable.
And those are organic growths. Those are physical growths on the vocal cords, right?
They're called benign growths. And then you have pre-malignancy growths, which are the next stage is cancer, called papillomatosis, leukoplakia, and keratosis. My biopsy study, biopsy means they actually verify that this is the condition, papillomatosis, not a node or a polyp or contact ulcer. And I worked on those cases for the dissertation. The study lasted 3 months, worked with them 3 times a week, every week, and within the period of 3 months, these growths of 8 patients involved were reduced or eliminated by direct.
Now that was quite a revelation, but even at that time, the correlation or the connection to the treatment of spasmodic dystonia was not clear to you at that time. Is that correct?
Oh, absolutely.
Okay. You did not make the connection to SD, you made the connection to these physical growths, these organic growths.
That is absolutely correct.
Okay. Who was the one who drew your connection that the same change in tone focus and pitch, by raising it out of the lower throat, could affect a change in this condition that Dessa Weiss, this famed psychiatrist and voice doctor, said would be a Herculean achievement?
Well, by looking at this woman who had the strangled voice. And you only need one case. You see, if you're trained and your mind is alert to it, the revelation is that we're going in the wrong direction, folks. And I spoke with 2 people about that case. One is the famed Friedrich Brodnitz of New York, who was instrumental in getting me into the field because I suffered with a bad voice, misdirected by two well-intentioned college professors.
Who told you, in effect, to lower your
the
voice?
pitch of my voice because I had a nasal, thin voice.
What did your voice sound like back then?
I am Mort Cooper, talk like that. And
so that was like a kind of a Brooklyn, Bronxy kind of voice?
Well, it was a typical New York sound. But
not typical of the Upper East Side.
Oh, yes, they talk of the British talk up there. It's a status-oriented thing. If I had lived in Britain and I was among the rich and the famous and the lords and so forth, I'd be perfectly fine up there. But I wasn't very persuasive with that voice. These 2 well-intentioned college professors told me to lower the pitch of my voice. So they didn't have the awareness. They were well-intentioned. And I talk like this. Hi, I'm Mort Cooper. How are you? And it was a great sound. There was tension in the lower throat. And I didn't realize that...
Were you speaking with volume at the time?
Well, I did use volume because I was very shy at the time. And a debate coach, I went after the debate coach, the debate team, and the coach was very, very observant, seeing me have my eyes up in my head and foaming at the mouth and my knees shaking. And he sat back in his swivel chair and he said in his deep voice, "There are only 4 years, Cooper." So I was hopeless. But he helped me to overcome stage fright by sending me to the chorus, which had me sing basso profundo in the lower throat, which added to the tension. He helped me to get stage parts in stage plays, and eventually I got a lead, which I realized my voice